Well, I don't often take time to talk about this, home-based business opportunities with Youngevity, but I'm going to do that today because we are growing so rapidly. We need help, and we pay extremely well. Some levels, including car bonuses, stock options. Obviously, whether you're a preferred customer, an associate at any one of the entry levels, you get the Youngevity products, the great Youngevity health products for wholesale. But you can actually add a significant amount of income, and because you own your own business, you have the right to have legitimate tax deductions, including your home office, an equal amount to the percentage under your roof in the house of your utility bills, your homeowners or renters insurance, and other legitimate deductions. When you travel to and from meetings to get education, to spend time and money and energy to go give a talk to a prospective client, you're looking at tax deductions that can help you get back a significant amount of the withholdings that your bosses withheld from you in your workplace. And so anybody who does not own their own business in America is really silly, because we don't want to take away the tax benefits from wealthy people. People say, well, those people don't pay taxes, we're going to take away their benefits. No, you don't want to do that. You want to get the benefits. And there's various levels you can come in at, and you can get the same benefits all these wealthy people get. For $10, you can own your own business, get an LLC. We don't give you the LLC, but you can get a legitimate business, and you can go online to these legal things online, get yourself an LLC. You don't even have to go to a lawyer to do these things, so it's very economical. And start your own business. Well, I don't know anything about business. I've been an employee all my life. Well, that's why we have the book Wall Street for Kids. We have the CD, $10 Path to Financial Freedom. And then we have the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And we teach you how to deal with over 900 different diseases using vitamins, minerals, and trace minerals, and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. Okay, that's the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And then don't forget Wall Street for Kids, because it teaches you the business side of how you can actually get your products for free. What if you only make a check that's enough to pay for your products? Wow, your products are free then. And, you're looking at a couple hours a week. And, of course, there's semi-retired people and retired people who put in more time. People who are laid off while they're waiting for a job, waiting to be called back. They can spend a little bit of effort and build a Youngevity business. And you can start out as a preferred customer, cost you nothing. You get an ID from Youngevity. You get a website. You get a password, and so forth. And it's a beautiful thing, because you start out with the products being at wholesale, and then once you decide you want to do it as a business, you can come in at different levels, anywhere from $10, which is the beginning level, which gets you in the system as a business builder, all the way up to $500 once in your life. It's a one-time fee of $500, and that gives you $500 worth of products, so you're not just giving away money, but it also gets you into car bonuses, stock options, and things like that. So there's all this stuff in between. Well, then when you look at Wall Street for Kids, the book, you're looking at a book that's written for the 5th grade reading level. It's really meant for parents and grandparents to read this stuff to their kids and join in business with their kids, because you want your child to be an entrepreneur. Jobs are not, what should I say, as predictable as they used to be is probably a good way to say it. Jobs are not predictable as they used to be. They're in at a lower rate. You're looking at less and less jobs. If you get a good one, my advice is hang on to it until you build your Youngevity business up to the point where it doesn't look like you need it anymore. Or you might like your work and you want to do that and just do your Youngevity business seriously part-time. By seriously part-time, it might be 10 hours a week, 20 hours a week. You don't have to do a full 40-hour week. And your goal here is to engage a dozen people who are like-minded with you. And you could be on the same bowling team. You could be on the same company softball team. You could be neighbors. You could be family. But the biggest pool of people that you're going to have access to are strangers. There's 7 billion strangers on Earth, and most people have 3 or 4 good friends. They probably have 5 relatives that live within an easy drive, and so forth. And so strangers are the bigger pool of opportunity for you to get information to. They could be waitresses, waiters. They could be people who own their own small businesses, and they're looking to diversify because the widget they were selling out of this little storefront, suddenly now people can get those online for half the price and so forth. And so he's looking for something to bolster his income stream. so he can survive until he figures out what to do. And so there's all these strangers out there who are really looking for help. And I have engaged so many people to the Youngevity business just by talking to people at the gas station when I'm filling up my vehicle with gasoline. When I go to restaurants, I talk to waiters and waitresses. When I go to the movie theater, I talk to other customers coming out of the movie theater and so forth. Go to the malls, I talk to people in the malls. I talk to people in the bookstores, in the grocery stores. Just talk to everybody. And people, why are you in that walker? Why are you using those crutches? How come you're in the wheelchair? And most people are afraid to talk to somebody who's disabled for fear of maybe embarrassing them. But really, they're very lonely in that wheelchair and in those walkers and in the crutches. And they're happy when somebody asks them something and they can talk about themselves a little bit. So get the book, Wall Street for Kids. Get the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, Passport from Empathy, and get the CD, $10 Path to Financial Freedom, and join Youngevity as an associate and help us save America. We'll pay you really well to do it. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, this is a Fox News story. It's actually something that I've heard you talk about for a number of years, so I think we ought to do one of these. Because you for years have warned, people, they've gotten into this thing where they tell you after somebody has a heart attack that, you need to be on an aspirin every day, and then you run the risk of getting bleeding out in your intestines or your stomach. Well, this is a news story that is about a study that was done in Denmark, and it's a Reuters story headlined, NSAIDs may boost bleeding risk after heart attack. They say people taking drugs to prevent blood clots after a heart attack, like ibuprofen, may lead to bleeding, stroke, or another heart attack, according to this new study. And the lead author is Dr. Anne-Marie Schering Olsen of Copenhagen University Hospital. They say anyone who has had a heart attack should be prescribed both aspirin and blood thinners, and it make platelets less sticky, reduce the risk of clots and a second heart attack. They say ibuprofen and other so-called NSAIDs also thin the blood, and they say for these non-steroidal anti-inflammatory drugs, according to Olsen's results, said adding NSAIDs to the mix is dangerous. Olsen's quoted as saying, there has been a tendency to think that short-term use of NSAIDs is safe. Our study suggests that that is not the case, and that even for a few days of use is associated with an increased risks of both bleeding and cardiac events, mainly heart attacks. They say that she was surprised that despite the guidelines which encourage the use of NSAIDs in patients with cardiovascular disease, 1/3 of our population had at least one prescription for NSAIDs. They say using nationwide registries in Denmark between 2002 and 2011, they examined records of over 60,000 adults survived at least 1 month after hospitalization for a heart attack. 34% of those filled a prescription for an NSAID like ibuprofen or naproxen and were also taking anti-clotting drugs. They say 3.5 years after heart attacks, nearly 1/3 of those that group had died. More than 5,000 of the survivors had of the attack survivors suffered a bleeding event in the brain and respiratory system, gastrointestinal system, or any other site. Of those, 799 died. And basically, it's another one of these cases where the doctors say, "Oh yeah, you need all these drugs after you have a heart attack to prevent another heart attack." And here we have a study that shows that it increases your risk for having another heart attack.
You're exactly right. Thank you for bringing that up, Doug. And of course, what they forget is that when you have a heart attack, it's not cholesterol, it's not saturated fats that's causing the problem. It's actually the things that are missing. Let's look at congestive heart failure. That's caused by deficiency of a single vitamin. Cardiomyopathy heart attack, cause of sudden death in athletes and people who do hard physical work. That's caused by deficiency of a single mineral. I've done 1,700 autopsies on kids under the age of 10 that have died of that one. And then you get coronary artery disease. You get plugged arteries, obstructive artery disease in the coronary arteries, or maybe even the brain, vascular dementia. And this is caused by inflammation and a lack of enough antioxidants to protect you from the inflammatory foods you eat, fried foods, processed meats, oils, gluten, that sort of stuff. And then, of course, there's blood clots, coronary thrombosis, thrombotic stroke, blood clot in the brain, pulmonary embolism. These things are caused by an omega-3 essential fatty acid deficiency, a ratio problem between omega-3, 6s, and 9s. One of my lawsuits against the FDA in federal court, and I prevailed there to show that omega-3 essential fatty acid deficiencies were the root of these thrombotic cardiovascular events, not cholesterol. And so these are things that we have to be on, and that's why we have the Healthy Brain and Heart Pack. Get on that, and I believe you can reduce your risk to zero for these types of events. But thank you for bringing that up, Doug. Let's take care of ourselves. You know, an aspirin a day is going to kill you. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Kansas. And Tommy, you're on with Dr. Wallach.
Oh, Tommy, you're on the air.
Hi, Doc. Thanks for taking my call.
What's up?
Talked to a lovely grandmother about her grandson. His name is Will, and he was born with sickle cell. He has his blood transfusions, as he needs them, and he usually ends up with pneumonia after he has those. He has a lot of aches and pains. I did not talk to him personally, so I don't know about the gluten issue.
Sure.
And he weighs 130 pounds, and he's 5'4", 27 years old.
Okay, 27 years old. All right.
Yes, sir.
Well, sickle cell anemia is kind of a very interesting disease. It's actually an inborn error metabolism. It can happen in black people. It can happen in white people. I'm assuming that Will is a black kid?
Correct.
Okay. But it can happen in white people, too. But you couldn't have a genetic disease from the black community in white people, so they call it thalassemia in white people. Same disease. These are inborn errors of metabolism. Mom is missing something when the cells in the bone marrow that make hemoglobin are forming don't farm completely correctly, or there's not enough of them. And so people are born with this hemoglobin that's not perfect. Now, Linus Pauling, the guy who got 2 unshared Nobel Prizes, there's only 2 people that ever did that, really a brilliant guy. He spent his entire adult life and his career looking for the genes that actually drive sickle cell anemia. Well, guess what? He could never find it because it never existed. Sickle cell anemia and thalassemia are both really inborn errors of metabolism. They're caused by a nutritional deficiency of the embryo during the time when the bone marrow is forming cells that make hemoglobin, okay? And so they're imperfect. You can manage the disease very well. In fact, I've been working since 1991 with the Sickle Cell Foundation of Georgia for that sort of thing in Atlanta. And basically, what you have to do is this. Get rid of all the bad stuff out of the kids' diet. Absolutely no fried foods, no processed meats, no oils, no gluten. Get rid of all the inflammatory stuff and take the pressure off all tissues, including the bone marrow. And then for the cells that are circulating, they're very susceptible to nutritional deficiencies, particularly of things like vitamin E and copper and selenium. And so they really need the healthy, this fella, let's see here. Shar, you could do this. Where are you at, Shar?
I'm right here.
Okay. Okay. What would you throw at this guy to get both the selenium, the copper, and the vitamin E?
I give him 1 healthy brain and heart pack, and I give him some extra selenium.
Perfect. Yeah, 3 selenium twice a day, 1 healthy brain and heart pack, and go ahead and divide everything else in half. Give him a half a dose of breakfast, dinner, and the likelihood of him having an event is pretty low. Okay, we'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Arkansas. And Susan, you're on with Dr. Wallach.
Oh, Susan, you're on the air.
Thank you. I have a 1.5-year-old dog that has ammonium burate crystals in the urine, apparently building up ammonia in the blood, which led to neurological issues. Her blood work was low ALB, low BUN, and low TP. They've put her on a white bread, white rice, Tums, synthetic sugar, amoxicillin, which is now gone, and low-salt diet.
Okay. What was the dog being fed before all this happened? Was it being fed dry dog food or canned dog food?
I've been feeding both a 5-star dog food, but now I find out about the issue of the arsenic in the rice, so I put her on a homemade now, and I put her on low arsenic white rice, but she was on a meat-based small breed.
Okay, yeah, this is not going to work, okay? Okay, 1.5 pound dog, what you need to do is get a good all-meat dog food, no grains whatsoever, no rice, no grains. And what you want to do is get an all-meat dog food, a complete dog food for toy dogs under 10 pounds of body weight, maybe even under 5 pounds of body weight, right? Then, Shar, what would you give for a supplement program to this dog?
Arthrodex, of course.
Well, Arthrodex. What else would you give?
Essential fatty acids.
Mm-hmm. Very good.
I pick mine because my dog's too small to swallow them.
Yeah, and so what you do is you actually puncture the EFA Plus and squirt it in the dog food, right? Hello?
Yeah, that's what I do.
Yeah, because your little dog, Bear, is only 5 pounds.
Yep.
Yeah, and so, okay. And so what you want to do is I'd go ahead and give this little dog a half a scoop of the Arthrodex, which is a little overdose, but that's fine. This dog needs some help here. But you need to change the food immediately. Do not attempt to make a meal for this dog. It won't work. It'll go from bad to worse. So you need to give this dog a complete dog food that's all meat, no grains whatsoever. It could be beef and chicken and fish, any combination of that stuff, lamb, anything like that, but absolutely no grains. And then, again, half a scoop of the Arthrodex in the food every day, and then also, as Shar said, 1 EFA Plus. Go ahead and puncture that EFA Plus, squirt it all over the dog food, and the dog will do very well, I'm sure. Okay, Doug, let's go to callers.
Let's head to Michigan, and John, you're on with Dr. Wallach.
Oh, John, you're on the air.
Hello, Dr. Wallach.
Yes, sir.
My wife is, I got a problem with my wife. We have, she has primary hyperthyroidism. She's been on Lipitor for about a little over 2 years, and I told her that stuff's going to give you problems. Well, it's come back to bite her. She's got sugars, elevated sugar. They got her on sugar medication. Now,
have they diagnosed her as diabetes or pre-diabetes or what?
Diabetes.
Okay.
So she's on medication, and they want to cut out her parathyroid gland.
Okay, because she's got high calcium in her blood?
Right.
Okay, well, fire the doctors immediately. This will be life-saving to fire the doctors immediately. Hang on, and we'll be back after these messages. Okay, Doug, we're going right back to Michigan and John. Okay, Shar, let's see here. John, first of all, how much does your wife weigh? Is she a big woman or small or what?
Weighs 250.
Okay, and how tall is she?
5'11".
Okay, so almost 6 foot tall. Okay. All right. So I would say she's probably 50, 60 pounds overweight. All right, is where I'd put it. Okay, Shar, here's a lady who's, now you're saying she's got an overactive thyroid or underactive thyroid?
Overactive.
Okay, and overactive parathyroid, right?
Thyroid. Numbers, doctor? 1.5 on the parathyroid.
Okay, very good. And she's taking Lipitor to lower cholesterol. She's got diabetes. And, let's see, she's about 50, 60 pounds overweight. What would you do for this gal, Shar?
Well, she's going through a thyroid, extreme calcium deficiency because her parathyroid gland is trying to rob calcium out of her bones to make up for what she's not getting in. So she needs to get on a gluten-free diet, and she needs probably 3. I would give her 3 healthy. Actually, she needs 3 bone and joint packs because she needs to rebuild her bones and everything. And then she needs extra Ocean's Gold for her thyroid.
Okay, what would you give her for the parathyroid?
For the parathyroid?
Yeah, how much calcium a day? It would be, you say, 3 of the healthy, what is it?
Healthy brain and... Yeah, healthy packs.
Healthy bone and joint packs. Yeah, healthy bone. You're exactly right there. What would you do for the diabetes?
Oh, she needs to get sweeties for that.
Yeah, so I'd give her 9 sweeties a day, 3 at breakfast, 3 at lunch, 3 at dinner. And the Lipitor, I'd ask her to consider dropping it. Lipitor, of course, will drop her cholesterol, but it's going to cause problems. She's headed towards Alzheimer's disease and many other adrenal exhaustion, all kinds of stuff. And I'd also get her on a diet that, as Shar said, gluten-free, no fried foods, no processed meats, no oils. That means olive oil, coconut, also margarine, mayonnaise, salad, cooking oils. But also I'd get her off of cruciferous vegetables because they interfere with thyroid function. So she should not be eating any cabbage, broccoli, cauliflower, Brussels sprouts, or kale. And again, as Shar said, the reason why people have high calcium and enlarged parathyroids is not because they're getting too much calcium, it's because they don't have enough, and the parathyroid is actually overworking, trying to pull calcium out of the bones. And doctors always get it wrong. They really should be put in jail for this because they put people in grave danger. They should actually be getting more calcium, not less. And the Lipitor, I would definitely, if it were me, I would just go ahead and drop right off of it. There's no consequences to cold turkey off of Lipitor. In fact, in February of 2012, the FDA sent an email out to every doctor in America that said, get your patients off of Lipitor, Zocor, Mevacor, and Crestor because they lower cholesterol and they increase the risk of type 2 diabetes by 52%, maybe why your wife has diabetes, and also increases the risk of Alzheimer's disease, and she may be having some dementia problems too. Now, what would you do to get rid of that 60 pounds she's overweight, Shar?
ASAP.
ASAP, right. I'd give her 2 bottles and a month of ASAP, put a dropper full under her tongue, 1 full dropper full, not a drop, but a full dropper full under her tongue, 30 minutes before each meal, and a second dropper full under her tongue, 15 minutes before each meal. And within a couple of days, she'll start losing a half a pound to 2 pounds a day. And that's going to get her going in the right direction. This is going to be a process. And so give us a call every couple of weeks, and we'll kind of walk you through this. Certainly, if you have any questions, feel free to call. But in the meantime, don't wait longer than 2 weeks to bring us an update. Okay, Doug, so let's squish in another one.
All right, let's head to Fullerton, California. And Kathy, you're on with Dr. Wallach.
Hello, Kathy. You're on the air.
Hi, Dr. Wallach. You're awesome.
Well, you're very kind. Thank you. How can we help you today?
I'm calling for my mom. She's 80 years old, and she has neuropathy, severe neuropathy in her feet, nerve damage. I see her feet get black every evening, and she's up every 2 hours at night soaking in cold water. She went through a huge program last year, paid $6,000, and
oh my,
they had her on gluten-free and all this stuff, and she was worse after.
Okay, well, here's the problem. See, when she lays down, is she getting up every 2 hours because as she lays down, the symptoms get worse?
Yeah, she can't. The sheets hurt her feet.
Yeah.
It's so bad.
Okay. She's 80 years old. What does she weigh, you think?
150.
Okay, 150 pounds. Okay, Shar, this is a Shar thing. What would you give a 80-year-old woman who's got neuropathy, peripheral neuropathy, what would you give her 150 pounds?
I give her probably 2 healthy bone and joint packs.
Perfect. Okay, yeah, because the neuropathy is caused by a back problem. 80 years old, you can expect some osteoporosis if she's not been supplementing properly, degenerative disc disease. How much has your mom shrunk since you remember?
She 2 inches or so. She has a big bump in her back. Yeah. Okay,
so she got the Dowager's hump stuff, right?
Yep.
Yeah, and so she shrunk 2 inches. What happens is that those discs shrink in between the vertebrae get closer together, and they mash the roots of the spinal nerves. And this is in her back. She's got would be called sciatica. Okay. And this is what's causing the burning and numbness and pain in her hips and legs and feet and so forth. When you lay down, it's going to get worse. It's called restless leg syndrome. So, okay, Char's exactly right. 2 healthy bone and joint packs, and none of the bad stuff. No fried foods, no processed meats, no oils, no gluten. And then she's got to have 2 healthy bone and joint packs. That would allow her to have 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. And that would be designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, very, very important here, and also bone matrix and bone itself. This is a repairable thing, even in an 80-year-old woman. I've repaired people who are 102 years old with this program, and so neuropathy is not something she has to suffer with. Also, with those 2 healthy bone and joint packs, Char, what's your opinion of the CM cream topically anywhere when you have pain? Is it good?
Oh, yeah. It'll work in 15 minutes or less.
Yeah, 10, 15 minutes, she should feel some relief in her feet. But you got to put the CM cream on her back, on her lower back, because what's going on in her feet is a peripheral neuropathy related to what's going on in her back. You put it on her feet, she's not going to get any results. So you got to put the CM cream topically on her back. Use it lavishly. And as Shar said, within 10, 15 minutes, she'll see some significant reduction in discomfort. And sometimes you get total relief for anywhere from 3 to 5 hours. And she may have to apply it 2 or 3 times a day. But give us a call every couple of weeks. If you would, Kathy, let us know how Mom is doing. but we can relieve her immediately of an enormous amount of unnecessary discomfort, and certainly even at age 80, we can rebuild her and support and promote maintenance repair of her disc and bones and cartilage and ligaments and tendons, so she'll be a new woman. Okay, Doug, how much time we got here?
We got enough time to get a question in, and
okay.
Let's head to Israel. And Margalit, you're on with Dr. Wallach.
Okay,
Margalit. Hi, and you're calling from Israel, Middle East.
I am, yes.
Oh,
yes.
Okay. Shalom.
Shalom. I actually spoke to Ricardo, but he's in Russia, and so he can't speak to me until next week. So I thought besides which, you sound so
you have to go quickly, dear. How can we help you?
Okay, sorry. Okay. Well, all right. I've got congestive heart failure. The original cause is tetralogy when I was born. Because of that, I've got an implanted pacemaker. Because when they repaired it, they didn't know where it was.
How much do you weigh? Margot, how much do you weigh?
Oh, I weigh 160 pounds, and I'm about 5 feet now.
5 foot?
A little bit. Yeah.
Yeah, if you're 5 foot, you're probably 50 pounds overweight, so hang on. We'll be back, and we'll give you some suggestions for congestive heart failure after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity 90 for Life Crusade, and we're back in Israel, the country of Israel, Middle East, with Margalit and congenital
heart. COPD and pulmonary hypertension, and my oxygen sats are down to 80. So
okay.
I'm on supplementary oxygen all the time.
Okay, now I need you to listen here so I understand. You have congenital heart disease. You currently have congestive heart failure. You got fluid in your lungs. You got primary hypertension. You weigh 160 pounds. You're 5 foot tall, right?
Yes.
Okay, now hold on. Get your pen and paper out. Okay, Char, what would you do for congestive heart failure?
She needs the de-stress.
Okay, and what else?
Well, she should be on 2 healthy brain and heart packs.
Perfect. Now, what would you add for the high blood pressure?
I would add Ultimate Daily.
You get 100 plus. Very good. Okay, so Margalit, you need 2 what we call, as Char says, the 2 healthy brain and heart packs per month. That's going to deal with the heart muscle itself and all the basic needs of all tissues in your body, including the heart. The de-stress capsule, I want you to have 3 of those twice a day. That's 2 bottles a month. That's going to deal with the metabolism of the heart muscle, specifically for congestive heart failure, which is really a deficiency of a single vitamin. Then, for the high blood pressure, you need to have 3 of the Ultimate Daily tablets twice a day, 3 at breakfast, 3 at dinner. That'll be 1 bottle a month of the Ultimate Daily tablets. So you're looking at the 2 healthy brain and heart packs per month, 2 bottles of the de-stress capsules a month. That's 3 of those twice a day. And then 1 bottle a month of the Ultimate Daily tablets. That's 3 twice a day. That's to support and promote healthy blood pressure and to support and promote healthy blood flow through obstructed arteries. And what would you do for the 50 pounds she needs to lose, 50, 60 pounds she needs to lose?
ASAP.
ASAP. Put a dropper full under your tongue. Not a drop, but a dropper full. 30 minutes before each meal. And after a couple of days, you'll begin to lose anywhere from a half a pound to 2 pounds a day. And that's going to help with the blood pressure, congestive heart failure, to lose that weight. And as long as you stay on your 90 essential nutrients, you'll never gain the weight back. And I've seen people really show really serious improvement very quickly with congestive heart failure because it's really a simple vitamin deficiency, a single vitamin deficiency. We've known it for 300 years. And, of course, medical doctors like to install pacemakers and defibrillators, and they want to do heart transplants and all this kind of stuff, but they never give you the nutrition. So you're in luck here, Margalit, by contacting us. At least we're going to get some nutrition to your heart and the rest of your body, too, and you're going to be a new woman. Please keep in touch with us, and we look forward to getting to Israel in the future. So we look forward to seeing you in person soon. Okay, Doug, how much time we have?
Got about 90 seconds here.
90 seconds. Well, Shar, in 1 minute or less, do you have some advice for our listeners out there?
Well, people need to start taking control of their health and not trust it to some stranger. They are the one that cares more about how they feel than anybody else. And each individual needs to take charge of their own health like they take charge of fixing their car.
Exactly. Well, you hit the point right on the head here, Shar. You need to think of Youngevity for you and your family, your church family, your neighbors, and your work family, as the Home Depot for your house. You want to think of Youngevity for your body. You want to think of AutoZone for your car and Youngevity for your body. And so use the same principles that you would for, do-it-yourselfing for your car and your house. Take care of yourself. You've got to be the primary care provider here. Don't entrust that over to the doctor because all he wants to do is use you as an ATM machine. $750 billion a year of fraudulent billing in America. 1/3 of the medical budget is fraudulent billing. 30 cents out of every medical doctor billed to the insurance companies by your doctors is fraudulent billing. They bill for things they didn't do, and they bill for things they did do, but you didn't need. So the more you take care of yourself, the lower your insurance rates are. The more you take care of yourself, the longer you're going to live. Well, thank you so much, Shar. Super job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.